As we sort of gather and reflect on 50 years of service to this region, I think it's an opportunity for all of us to kind of stop and reflect for a moment. And for me, that means reflecting over the last 18 years and how St. Clair has changed, evolved. We continue to grow, continue our focus on the needs of the region, and I hope we continue to do that for 50 more years.
It's a wonderful, rich history.
Dr. Louise Caudle was the prominent doctor. We all just loved her.
She was my doctor when I had my son down at her clinic. She was a dear.
We wrote a play for her. She had been delivering all of her babies in that little building. She was really wanting a hospital bed.
Louise talked to him afterwards. She said, "We really need a hospital here." And he said, "Lady, if you need one, you can get one." So he sent her literature on Hill-Burton, which you raise so much money, and they will cover it. They will match it, that's the word.
The people of Moorhead were looking to build a hospital here so that they could have access to health care here in Moorhead.
What we wanted to do was we wanted to be something that wasn't seen in Eastern Kentucky, and we wanted to provide a service.
And I think the people, the community, tried many different sources for partnership until they asked the Catholic Church, and the church asked our community, the Sisters of Notre Dame, to help to build and to sponsor the hospital.
We won one run by a religious organization. Our pastor, who was here at that time, told us about Monsignor Towle from Covington. And he was familiar with this Hill-Burton and so forth, so he came down and talked to Louise.
The Sisters of Notre Dame is an international congregation based in Rome. We came in 1960, and I think we were unknown at the time in terms of who the Catholic Church was and who these, in that time we were more black-robed women with veils. And so it took a while, I think, for the people of Moorhead and the surrounding area to get to know who we were.
Sister Jeanette, who had been here, I think, 13, 14 years, loved by the organization, had recently had a cancer diagnosis and was obviously leaving at that point. And so that was a tough time as far as the organization was concerned. And then I come on the scene again as the first non-sister CEO, and while I was certainly welcomed with open arms, I think the board and the sisters who had more contact with me over a period of time certainly felt comfortable, and I felt comfortable.
I think St. Clair has always been about the patients. I think the sisters set a tone for that really early on.
You knew that they
did have that mission to make this hospital a good hospital. They worked hard at it, and you knew that's what their goal was.
We got word about this hospital opening and we accepted it, the sisters did. When we found out who was going to be picked to come down here, well, I was scared to death when I heard I was one of them.
When I got here, I mean, things were different, but I liked it from the beginning.
I wanted to be in a more rural community rather than stay in Lexington where there were all kinds of internists, and out here in eastern Kentucky there just weren't any specialists other than at the miners' hospitals.
Came to Morehead and met Dick Carpenter and Hunter Black, and I said, this is the place for me.
Well, we had a fairly impressive beginning. Warren was from Harvard, Cal Bigler was from Yale, Herb Hudnut had been at Yale and was a Presbyterian, and I was from Cornell. So it was, it was not exactly your everyday hospital staff, and it was a good hospital staff.
From the beginning, there was discussion about bringing students and residents here, and that's what attracted, I think, my father to coming to Morehead.
Dr. Proudfoot was an eminent surgeon here, Harvard trained. Everyone knew who he was.
Warren was good to me, I was good to Warren, and we all got along well.
But we were busy almost from the beginning.
Early on, the work was really hard.
Louise had a lot of babies and would be here all night and then go in her office during the day. So she worked many a night almost with no sleep, and then she'd be in the operating room in the morning putting the surgery patients to sleep.
But that was just the way it was. And you get called at 2 in the morning, you go in and see the patient.
In the early days, as I read the history, it was the establishment of pharmacy services and the establishment of social work services and physical therapy. And by the time I came on the scene, certainly the foundation for most of the essential services were there.
People have watched the hospital grow over time, and I'm never amazed at the people that say, wow, we had no idea that they were doing, this service or that service.
The environment around us has certainly changed dramatically, but trying to keep in tune with the needs of the region. Obviously there's various services that we have today that we didn't have 20, 30, 40 years ago.
When I came here as an ER doc, we were seeing only 14,000 people a year in the emergency department. I think last year the numbers were 33,000 patients in the emergency department.
I always felt there was a real positive feeling between the nursing staff. And always considered them really important. We've recruited an enormous number of physicians to this community over these years. Probably wouldn't have happened as rapidly had there not been two clinics.
The specialist came in with the consultation clinic. There was a decision to switch to a private practice, and my understanding, it started as the Kvardt Clinic. As time goes on, I guess not untypical, surgeons and internists don't always think the same way about things, and so the internist then went off and created a Moorhead Clinic.
I liked all the people here. I did. People were nice to me. People took to a woman doctor just fine.
I always felt like the community was very supportive and appreciative.
You'd have to go see elderly people in the homes, and we did that.
That is one of the things that we cherish the most, the relationships and the partnerships with the people in the civic community of Moorhead.
Terry Cottle tells some great old stories of how what it was like in the community when she first came here in the 40s, and no hospital, and how when Louise went into practice, and the need and the desire for a hospital really built over time, and of course Louise was part of her extended family, and how her family and her Terry's family was part of the banking side of the Cottle family, how that branch of the family really gave support to Louise and her move to bring a hospital here and to finance it and to get excitement going in the community for earning money for the hospital and community support so that there could be some matching funds.
The Moorhead State University Infirmary, they would see patients in the morning, afternoon, and a doctor would go up there at noon on his lunch hour to see which patients needed to be seen in addition to what they had seen early.
We were still here connected with the university. So they sent students and occasional interns.
The association attraction initially was also augmented by the connection with the University of Kentucky in terms of education. So I think that was important early to influence my decision to come here.
Those relationships, whether it's UK, Moorhead State, University of Pikeville, we're reaching out and continuing to involve ourselves with programs and services that will benefit our area.
You know, I wish that I had a nickel for every time someone in the community has told me how much they appreciate the hospital, because I'm of the age that a lot of people I know remember when there was no hospital.
I think they had no idea that they would grow to be this big and this involved.
We still, I think, have that strong sense of mission, and the evolution of services over the years has really been based upon that early mission.
Any place I would want to be would be St. Clair's. It's such a part of me.
Our sisters have been so committed to the hospital at St. Clair, and to its growth over the years, and so proud that we can be part of what we call amazing medicine close to home.